People think of the heart as it's broken or it's normal. But actually, like the heart, it's like an orchestra of different instruments playing together, and they have to harmonize in a certain way to make the sound beautiful. But if one instrument goes too strong or one instrument is too weak, then the whole orchestra is abnormal. I think the inspiration to choose cardiology was first galvanized when I experienced a scene in the emergency department. And I recall that there were a lot of patients coming through the ER at that time. And I remember like a patient was having chest pain and was concerned for a heart attack. And I recall how tense the moment was there and how much anxiety in the ER at the time because of the concern of how life and death those situations can be. And when I saw the cardiologist come in and handle the situation and provide support for the family and ultimately treatment, it really showed me how pivotal being a cardiologist could be and the impact you have on families, and that really made a meaningful memory for me and inspired me to pursue cardiology. When I first got to JAX, the research was mostly focused on establishing genetic causes of heart disease, particularly heart failure that we study, and cataloging the different variants that a patient could have. We typically would treat patients collectively the same way. If they came in with heart failure, we would group them and we would treat them with medications independent of their unique characteristics. Now what we're doing is very different. Now we're actually trying to understand how the genes and the variants cause the disease at a different level. And that capacity is enabled by building advanced mouse models, animal models, and cells where we can use really innovative approaches to put in what a patient may have, but kind of like an avatar of the patient. And we can understand, the common and the specific problems that patient would have on an individual basis. Beyond understanding and cataloging the variants, now we can actually go in and rewrite the variant back to normal with things like CRISPR technology, which is really, I would say 10 years ago, almost science fiction. But not only can we do that, we can develop therapies based on their genetic issue that they have particularly. The advantage of JAX is the capacity to make animal models that are avatars of patients, particularly the genetic types of diseases, at a scale that provides us unprecedented opportunities to both understand all the different flavors of a disease and then test treatments more efficiently because we have such a vast capacity.